some dogs and cats, I guess, maybe a little bit more prone to sunburn. Anything that may be lightly pigmented, white colors, that kind of stuff. Collies in particular are really prone to get sunburned on their nose, and that can turn into a cancer type situation. So cats can get sunburns with chronic sunburn and chronic sun exposure. They can develop cancers on the tips of their ears, of all things. So they can get sunburned. And as a general rule, say if a white-haired dog was maybe clipped down and his skin was exposed, they could potentially become sunburned. Sometimes this is hotly debated about shaving down a double-coated dog with a lot of hair. It has a lot to do with heat transfer and all that. It is protective as far as the way they cool and all that, which doesn't make sense. It wouldn't seem likely that having a parka would keep you cool, but if they're shaved down, the way their hair grows back, it works against them. The way the cooling nature of the undercoat and the overlying coat works, it grows in different, and they're actually not as cool as if they were just let to be unshaven. We don't see as much snake bite as you think that we would, but when it does happen, most of the time it's from a non-venomous, like a black snake and things like that, and those can be some soft tissue swelling around the bite site and some pain and all that. With the venomous snakes, rattlesnakes and copperheads, those can be really deadly, obviously, and what most of the time happens with that is it can cause severe tissue damage and death. And on a general practitioner level, we like to refer those to an emergency hospital that may have antivenom, things like that. If that's not really a possibility, antibiotics and huge doses of anti-inflammatories and things like that. But it can be a really serious matter. If your pet's becoming dehydrated, early signs of that would be the whole dry nose thing. That's a pretty good indication to a certain extent if they're becoming dehydrated. If their mucous membranes, if they're tacky to the touch, when you put your fingers in their mouth and kind of touch on the gums, if it's a little sticky, that's an indication of being dehydrated. You can grab their skin on the loose part of their neck and you can pull that up, and if that stands up, that can be some moderate to severe dehydration. In extreme cases of dehydration, they'll present recumbent, which means they're unresponsive, laying on where they can't get up and things like that. Anytime you have prolonged vomiting or diarrhea, you really have to be concerned about that. And other medical conditions like kidney issues and diabetes and things like that, you really have to be aware of that.